Okay, we're going to kick off. My guest today is Tina Woods, who is the CEO and founder of both Clara Health and Longevity International. She'll explain a little more in due course about both of those endeavors. But I wanted to sort of step back and frame why I think this is going to be a timely and a fascinating conversation. I don't know about you, but prior to the pandemic, my knowledge of molecular biology, genomics, epidemiology, vaccinology, a whole range of areas related to human health, I would say was limited. I mean, we'd done some work at the Conduit on some of these questions, in particular the intersection between rapid advances in the healthcare sphere and in AI, and I've had certainly some conversations with scientists based in Oxford around this, but I'd say our knowledge was at a fairly basic level, and I feel as though we've been catapulted into a world where understanding these fields has become a central question related to kind of human existence. And then simultaneously, we are faced with a pandemic which has had wildly differential impacts on people's, depending on their age, that it is principally, thus far with some exceptions, a disease that targets the elderly, as evidenced by the terrible deaths that we've seen in care homes here in the UK, but also in people who are 60 or 70 and above in the rest of the world. And therefore, I think there is this intersection between aging, biology, and AI is just a very, very interesting and fertile area. And therefore, I'm very excited to have this conversation with Tina. And so, Tina, I want to start off just by establishing a kind of a baseline. Can you tell us a little bit about what the two organizations that you have co-founded and lead do? And then I want to kind of launch into a conversation about what the potential and the promise of this current moment is in relation to your work.
Sure. Yeah, so I wear quite a few hats, but they all interconnect in many, many ways, and very, very synergistic in many ways. So I founded Clara Health 3 years ago, and I always had this idea, and this is actually how it's turned out in practice, is I build ecosystems to drive change, because the big challenges in health, require big thinking, big action by a number of different stakeholders cross sector. So I really connect government with academia, with business, to really drive sustainable change in health. And I'm very, very interested in this whole paradigm shift that needs to take place from sort of moving away from this whole sort of sick care model through to the well-being sort of model. And of course and of course with the big disruptors that we're seeing with technology, the aging demographic, and dare I say pandemics, we're seeing this huge need to actually really focus on how we can keep people healthy and well, rather than see health as actually what to do when we're sick. So my whole sort of focus has been very much on that. So I work in the private sector, obviously in the public sector, do an awful lot of work, and have been doing a lot of work with the NHS, NHSX, academic health science networks on AI and data-driven technologies, what that's going to mean for the future, policy angles, but also supporting the innovation ecosystem. Been working with UKRI, Innovate UK, on the Aging Society Grand Challenge, in particular the Healthy Aging Industrial Strategy Challenge Fund. Had a brief, a couple of years ago to find unusual suspects to to get big companies working with smaller companies, the startup world, with third sector, big collaborative sort of partnerships, because you really need those to drive, real change in health. So that's been a fascinating project, and continue to work with them. In fact, a big piece on impact investing at the moment. So, and then private sector work, again, connecting big companies who, of course, are all fearful of, being eaten for lunch by the next sort of Uber Uber or whatever, so helping them sort of get to grips. So, so fascinating work with Clara Health. And then through all this work that I've been doing, I realized there is a need to look at this government mission that was set 2 years ago, in fact, on how to deliver 5 extra years of healthy life expectancy while minimizing health inequalities. That was actually set by Theresa May during her time in government, and actually is in the Conservative manifesto still to this present day. Obviously, we've had the pandemic, but actually, the realities that we're seeing through the COVID-19 epidemic are actually throwing a real spotlight, and how ever more so we really need to address, in particular, the health inequalities piece. So with that, I set up with my business partner, Dmitry Kaminsky, Longevity International. And what I've been doing is driving with Damien Green, who's the chair of the All-Party Parliamentary Group for Longevity, who of course was Theresa May's Deputy Prime Minister. He had an interest in the space, and with my other sort of partner, Lord Filkin, who had set up the Centre for Aging Better, we, together with a huge ecosystem of experts, scientists, business leaders, third sector, people like David Halpern, Behavioural Economics Unit, Lord Willits, Camilla Cavendish, whole ecosystem of people. All last year, we set to task, how can we deliver this goal? And we used, obviously, the All-Party Parliamentary Group as a vehicle to drive to look at this. But of course, so we developed a strategy in a very, very agile fashion, very quick, and had an enormous amount of organizations behind us, Health Foundation, King's Fund, Genomics England, so many, Health Data Research UK, Public Health England, all these organizations were all involved in this process. So actually, funnily enough, right before COVID, well, actually it was sort of simmering sort of internationally, but we launched the strategy on the 12th of February this year. And I had just come back, funnily enough, from a trip to Singapore, because I've been asked to speak about our work, with the All-Party Parliamentary Group, because I think it's been attracting quite a lot of international attention because of this way that we've been connecting government with business and with science, to really look at this. And had just come back from Singapore. And when I was in Singapore, obviously they were starting to, gear up. And when I arrived, the first thing when I got to the hotel, I was given a mask, hand sanitizer, everywhere where I went for the 3 days that I was there. Had to wash my hands, put disinfectant on my hands, got back, launched the strategy, and then literally in the 3 weeks after that, or a month after that, we started realizing, oh my goodness, the UK has been hit by this thing as well. And so of course, but what was interesting, and as we found out very, very quickly with the COVID, and of course lockdown happened, I think it was the 23rd of March. So that was basically a little over a month after we had launched the strategy, which, by the way, was launched with full backing and support by Matt Hancock, and a whole array of people, in February. And so what we realized, actually, as we were starting to see the impact that the epidemic was having around the world, and indeed in the UK very, very quickly, we could see that really, and what we could have predicted as well, was that it was hitting our most vulnerable. So we talk about the elderly, but of course, what we're really finding out, and this is where the data, and of course, there's that whole discussion around data, is it the right data that we're looking at? And of course, all this is going to come out in the wash as we do this whole sort of post-epidemic sort of evaluation, is, the epidemic is hitting, yes, our most vulnerable, our most deprived, yes, our most elderly, but actually it's fundamentally those who are in the poorest health. And of course, age is a major risk factor for all the chronic diseases that we're seeing, including dementia, and of course, cardiovascular diseases, diabetes, and all the rest of it. But actually, and this is where the whole science of aging has been fascinating, and the whole scientific community, particularly those involved in the aging and longevity space, of course, they were the first ones to really sort of cotton on, listen, if we're going to look at how we can protect, those who are being hardest hit by the crisis, we can use actually the science of aging to actually look at this and actually, come up with strategies that will deal with this underlying health resilience, because it's really this underlying health resilience that we're really talking about. So of course, it's our elderly, and of course, it's those who've been in care homes. Of course, it's those, with diabetes and cardiovascular disease, those, and obesity, and indeed, being overweight and being obese has been almost, a massive, it's it's double the risk of dying in hospitals. And of course, this is where Boris Johnson's war on fat sort of emerged. He came perilously close to his own death and kind of realized himself that actually this greatest epidemic that we've had, and which people keep talking about, and which have been endless sort of reports, Sally Davies, that was her swan song, the former chief medical officer, the obesity crisis in children, it's really coming to home to hit us. Actually, it's these underlying sort of health issues, these sort of, chronic diseases that in the end are creating, one of the reasons why we're being so hard hit by COVID. So this is where we've seen this huge acceleration of scientific research, collaboration, scientific community. Of course, we're seeing that with vaccinations. We need a vaccine, but actually we also need to address this underlying health resilience piece. And actually it connects up with health and wealth are also interconnected, because really what we've seen as a result of COVID is the fractured lines of society being kind of exposed in horrific fashion. It's those who are, from our deprived areas, we know that, the Conservatives got in on this levelling up agenda. And of course, we know that actually what we really need to address is the fundamentals of actually the inequalities in society. So, Michael Marmot, with his 10 years on review, talked about that, just after actually our launch of the Health of the Nation strategy. So it's all these broader issues, and we're seeing that in the US. So lots of things are coming up. Sorry, I'm going to stop there for a sec.
Yeah, no, so much to say. So can you just distill down what it is that you're doing to, tell us about your work and what it is that you're specifically trying to do?
Absolutely. So right now, in terms of what I'm doing right now, there's a piece of work which came out of the work that I initiated with my sort of partners within the Academic Health Science Network and NHS. We're actually doing a lessons learned from COVID piece. What can we keep? Let's not waste a crisis. What can we keep doing? I mean, we've seen things happen in weeks that used to take years in terms of digital acceleration. So all the things that we're seeing in terms of NHS and private sector partnerships, the community response, all these sorts of things which are incredible. And what we're seeing, we're looking at what can we move forward before we kind of go back to normal. So that's a piece of work that I'm doing right now. In fact, after this call, I've got a focus group, looking, assembling some people, who've all been living and breathing this crisis. What can we take forward so we don't go back to normal? I have just come out of a very, very busy period last month, actually, with the all-party parliamentary group activities. So one action that we had in our action plan was looking at this concept of the business coalition for healthier, longer lives. And so what we realized, as the sort of the epidemic was in full force, is that while government and the NHS were obviously heads down on just dealing with this crisis, and we had, some of the actions were around, we need to put more focus on NHS prevention, which of course is something that has to happen. We need to put more budget and attention on, what we can do to keep people healthy and well. So, but meanwhile, we realized what we could do. And of course, we've seen the huge response by the business community already with the incredible things that have already, the innovation, the business response. So we thought, well, while we're living this crisis, let's get the business community together. Let's look at how we can form this coalition. And one of the things we had this idea of how can we incentivize socially responsible business practice, to deliver on this goal that we set for healthier, longer lives while minimizing health inequality. So we had 4 roundtables that we held, and of course, we used all the latest Zoom technology. It was absolutely fascinating how we managed to convene 300 people looking at some of these key questions. What can we take from this crisis that will feed into what this business coalition should do, including this idea of a business index to measure the contribution of business to the nation's health? Because what we've realized more than anything, and I think the big takeaway that we must take from this crisis, is that health is not just the NHS. Yes, we love our NHS and we must protect it and all the things that we are so important, but we have to see our nation's health as being something that all of us need to be involved with, us as citizens, as business leaders, third sector, community leaders. I mean, just look at the hyper-local response that we've seen, in the communities, with people. So what can business do, working with government, working with academia? So we looked at this idea of the index. So what can we call out business for? So this idea of commercial determinants of health. We know health the wider determinants of health. You know, we know that, you know, your environment, where you're born, your income levels, you know, all these have huge bearing on your health. But what can the business community do? So we looked at that, and so we're now forming this business coalition. We've got a SCOPA meeting on the 1st of July. We hope to launch in September. So we're assembling, you know, what this business coalition should do, how we can look at the commercial determinants of health. We know, for example, if you just look at obesity and diabetes, and nutrition, which keeps on coming up as a massive issue that we need to tackle, we know that, you know, there's a lot of pseudoscience in food labeling, you know, that there's, you know, we need to look at sort of licensing. You know, we know that in poorer communities, they have, you know, 10 times the number of KFC shops, and in richer communities, you know, how can we look at this as a community and as a business coalition, and working with government and looking at the evidence base, working with academia to really sort of call out but also reward business for positive, you know, contributions to health. And that includes working practice, it includes age diversity. We know that there's gender diversity, but let's look at, and especially coming out of the crisis where we know there's going to be massive layoffs. We know that ageism is rife. We know that our older populations, they will need support to be able to, you know, get the balance right, you know, in work lifestyle, being able to, you know, work for longer, being able to take time out, you know, carrying responsibilities. These are all areas that will require legislation and sort of a different way of doing things. So huge activity there. And of course, you know, the other thing that I'm doing, I've just finished this book, which actually ties together, because we need to engage the wider population, the wider public and the citizen. That keeps on coming up and over again, you know, with my work in the NHS and academic health science networks, it comes up again and again with All Party Parliamentary Group. We have to get the wider citizen, the general public, on board with how can we mobilize, you know, everything at our disposal, but also the role of technology in delivering better health for people. And also, you know, health equals wealth. You know, there's that whole piece there. You know, it's all interconnected. So, so I wrote this book, which was supposed to be published in April. Because of COVID, we delayed publication to September. It's out on Amazon now, but it's called Live Longer with AI, and how artificial intelligence can help us extend our health span, but live better too. And so we explore, you know, how we can use AI, how we can harness the technology to deliver, you know, better health for people, address the health inequalities piece, all these sorts of things that are so important.
So can you give, just from your book, just perhaps, you know, just distill down just, you know, one or two kind of findings that you think are interesting about the intersection of how indeed AI can help, you know, people lead both healthier and longer lives? Sort of give one or two specific ways in which that might work.
Sure. So, so I interviewed about 30 experts and fascinating individuals in their own right, who are all pioneers in their own right, whether it's in science or business or, you know, entrepreneurs. I mean, I guess some of the big themes is, and there's a couple of things, and of course, you know, the epidemic and the pandemic has really shown a spotlight on a couple of them as well. But I think for a start, you know, human health is so interconnected with planetary health. I mean, that's, you know, we're seeing that with the pandemic. You know, in fact, the Centers for Disease Control, they have a concept called One Health, and it's all about the interconnectivity of human health, animal health, and planetary health. And the pandemic is really showing how important it is that we respect, you know, the precious sort of balance that there is of us as humans and our connection with the wider environment. And where that's really relevant is there's a few concepts in the book that I talk about called, for example, this concept called the exposome. So it's the environmental influences on our health and on our genes. So one of the really interesting sort of, you know, one of the big areas that I explore in the book is obviously the whole sort of science of aging. And so some of the people who I interview, you know, who are extremely involved in that whole sort of section, like Aubrey de Grey, for example, Nir Baseline, Einstein, you know, these are all people who are really trying to understand the whole biological basis of aging. And of course, what we see is that it's all kind of connected with chronic disease. There's concepts like obesity, which is basically saying, listen, you know, all these chronic disease, they lie on a spectrum, and that there are these underlying disease processes, which, you know, yes, there's obviously the genetic aspect, but of course it's the wider wider environmental influences, and this is the epigenetics piece of this, and there's a whole bunch of companies out there that do sort of epigenetics. It's all very early days. It's a bit of a wild west at the moment, as we're sort of, really understanding the science, and this is of course where AI is so important. Things like microbiome, for example, what we eat, what our gut flora, how it interacts with our genetic expression. So people like Tim Spector, who's an expert in genetic epidemiology, who's written a couple of books on diet. It's these wider influences, on what we're given from our parents, what we can influence through our lifestyle. For example, I interviewed Eddie Hall, the world's strongest man, who he discovered he had a genetic mutation, which is similar to the genetic mutation that the Belgian blue cattle have, which gives them huge muscle bulk. And so he started to understand what gave him some of his natural sort of gifts, through his genes, but actually working with that, what food, how can he, get peak performance? So that it's this whole sort of arena that's opened up in terms of, yes, understanding the genomics, and probably many of your viewers will know, the Human Genome Project, but actually now with, of course, all the work with Genomics England, of course, we now got this big genomics alliance looking at, what we need to learn about, what puts us at risk of COVID, for example. It's all really trying to understand the interconnectivity between what we have in our genes, how we interact with the environment, how our genes are influenced by the environment, the wider exposome, as I call it, and what we eat, our lifestyle, our activity levels, our sleep. Sleep is a massive, area of interest. I think it's is it Matthew? I think it's Saeed who wrote that book. Why we sleep. We should be spending about a third of our lives in sleep. Most of us don't get enough sleep, and that has a huge bearing on our risk, even for dementia, for example. So what I'm fascinated by and is understanding, the science of aging, how we can use that understanding, to incentivize ourselves to lead a healthier life, eat better, sleep better, all the things actually that our grandmothers used to tell us. Go out, get your fresh air, go see your friends. Social connections is massively important too, of course. Loneliness is the biggest killer of older people. Eat your greens. All that has now been, this is scientifically being kind of sort of validated in immense detail. And I think going to the AI issue, and this is where people like Alex Zabaronkov, who I also interviewed for my book, he is one of the leaders in AI-driven drug discovery, but also this concept called the aging biomarker. So these aging biomarkers, looking at these so-called aging clocks, there are ways in which you can measure, how your body is aging. So this concept of biological age will be something that I think more and more of us will start to understand versus chronological age, how our internal bodies are aging, how fit and resilient we are, even to, for example, COVID. It all has to do with, how our bodies are aging and in response to to stresses and environmental influences. Now, some of them we can't control, but of course, some of them you can control. And this is the interesting thing, and that may be the key to help us, motivate ourselves to lead a healthier life, or else to be nudged, because that's the other role that, for example, the tech companies, of course, know this, nudging us. And of course, the big marketing companies, big consumer companies, they know how to incentivize and use sort of nudge and behavioral sort of techniques to nudge us in the right direction. But we can use that in a way, in a very, very positive way, rather than just sort of drive up, company profits, or indeed, the GAFA, sort of world domination. Why not use that in a way that can harness that understanding of us, of our data? So that's the other big theme, and I'll shut up in a second, but the other big theme is harnessing our data in a way that can really deliver, for ourselves, healthier lives, but also to deliver on the public good, a healthier society, using that understanding of data, us as individuals, but also at a population health level, to actually, really, really understand, what is it that we need to do to have, a healthier nation. And so that also calls into, opens up a whole discussion around these big things that are happening, these big geopolitical sort of discussions on data and AI, and the sort of dominance of China versus the US with the tech giants. And then us, and this is an interesting time, we're about to, we've got Brexit, who knows what's going to happen with how we how we fall out or not, but we've got, the EU who've got some really interesting ideas on this sort of ethical data economy, countries like Estonia and Finland. I was in a fascinating talk yesterday, actually, with Finland, a group called Citra, who are looking at this concept of the I-hand. So it's the human equivalent of the IBAN standard in banking, but how can we harness data to deliver on humanity, on the human public good, using data in a socially responsible, ethical way. So it puts a whole new slant, because, data health is our greatest asset, but actually data that can shed light on our health, what we can do to improve our health, and we can, and it's not even, and health data is everything. It's how we live our lives. And that understanding comes from everything from banking records to social media to what we eat in supermarkets. There's this wealth of what I call data that sheds light on how we behave and what could keep us healthy and well as opposed to sick, what can keep us out of hospitals. So NHS data, that's data on us when we're sick. The most important data is actually data on when we're healthy and well. And this is the data that a lot of researchers and scientists are really interested in. And this is where this concept of the aging biomarker, understanding how we age, how we can keep healthy and well as we live our lives, is actually all about the 90% of what I call the healthy data. And using that data to really understand, at an individual level, at a community level, but also at a population level, concepts like what I call decentralized health resilience. So start on the individual. Yes, for those who can do it, and of course we're going to have our vulnerable and those who don't have access to digital technologies and all the rest of it, and that's where government and NHS and social care have such a massive and important role to play. But there's a lot that we can do ourselves. There's a lot that communities can do to understand what's happening at a local level, at a community level, and with their health populations. Concepts like civic data cooperatives, data collaboratives, where we can, using that trust in local communities that may not be at a national level, will harness that trust, with citizen, as citizens, harness that data, and then building up to this kind of decentralized national health resilience, or kind of some of the ideas that I speak to in the book, because there are different models that we can look at, which aren't necessarily the kind of the big tech model. It's not the social credit model that AI is, with China, which is absolutely galloping ahead in AI. We can, there's a different way that Britain can look to. So I think it's a really interesting time for Britain as a nation. We have so many gifts as a nation. We've got creative industries, we've got the, very vibrant tech ecosystem, we've got life sciences industry, which is, still, the most excellent in the world. And we've got obviously, the fintech, ecosystem. We've got, an incredible basket of strengths, and of course the aging, the grand challenges, government. We can harness that in a way that could really, be a shining exemplar of the world. And already, we're getting attention. Some of the work that we're doing with the All-Party Parliamentary Group, going to Singapore. We had a lot of international people, at the roundtables last month. So, it's a really interesting time looking at, how we can help people keep healthy and well, how we can deal with the crushing health inequalities that we must address, how we can, incentivize and move towards a model where we can look at, the SDG goals, look at another big idea, that we're exploring at the moment with the All-Party Parliamentary Group is a framework for health, a risk management framework for health, in a way that we're already doing in the climate change agenda. So I will just finish saying, a lot of the solutions for healthier lives are actually connected with living greener, the climate change agenda. So that is again another theme. Well, why not we, in the same way that 10 years ago, the climate change started looking at, the risks of an unhealthy sort of, of climate change, we could have the same approach with respect to health. We're already seeing, look what we've had to do to protect our nation's health. And, we can do the same, use the same approach, with institutional investors, guiding, with ESG mandates. We can look at, a whole new way of actually seeing health, and, from a risk management point of view, and see a whole sea change that we're seeing in the climate change agenda. And it's also another way of engaging young people as well. So lots of big themes all being explored in the book that I've written, because fundamentally, more than anything, we need as citizens to really understand what's at stake and what we as citizens have a responsibility to do. We are the ones who vote in governments. We are the ones who are running businesses or, teaching, our kids. We all have a role to play. So, and with that, we need the knowledge. We need the empowerment that goes with it.
So astonishingly, we're out of time. So that went far. I guess I'd love to try and if you can try and distill down into some sort of could you? I'm keen to kind of try and understand a kind of an example of what AI has given us that extends human life in a kind of practical, prior to the kind of pattern recognition, vast data, crunching, signal detecting from the noise capacity of AI. What have you seen as a kind of practical example of what it has done to advance aging that we didn't have beforehand? Could you just give us, by way of ending, just sort of a pithy example of that? Because I think obviously this is such a complex and vast and interrelated field, but just a takeaway would be just, I think, very helpful.
Well, I mean, I think the greatest potential of AI in many ways is actually spotting the patterns between all these disparate data sets in our lives. So genomic data, financial data, data on our physiology, on our our metabolics, our microbiome, being able to spot patterns in all these different data sets and harnessing, and this is obviously where the real strength of AI is, being able to spot those patterns that humans would never be able to spot. And really start to unearth, at an individual level, but also at a population health level, what is it that puts us at risk of these horrible diseases of aging? Because, all these chronic diseases, and cancer, of course, being one, of course, cardiovascular disease, and the one that we most fear and dread is dementia. They're all connected. And actually, this is where the power of AI, and this is where, just going back to what I was saying about really understanding this, what I call the healthy data, this is where we will unearth what is it that puts us at risk, and most importantly, what is it that we can do? What can we do to intervene to put us on a better trajectory? So I think that's the most exciting, and I think that's where a lot of the science is going. And we have to move away from this idea that what keeps us healthy and well is what we can do when we're sick. It's so much more important to focus on what we can do when we're healthy and well, and to keep us healthy and well. So this is where everything needs to shift, and including our wonderful NHS. We have to shift in that direction. But it's the whole business community, but we as citizens, we all have to move to that place. So I think that's the most exciting area.
Amazing. Well, thank you so much for. Could you just do a little shameless shout out on the name of your book, so that if people are interested, they can follow up?
Yeah. So it's called Live Longer with AI. It's out on Amazon. The subtitle is for pre-order on Amazon. It's actually being published on the 9th of October. But the subtitle is How Artificial Intelligence Can Help Us Extend Our Health Span and Live Better Too. And I've got amazing people I've interviewed for the book. So yeah.
Fantastic. So we've got that. Tina Woods, thank you so much for your time. Obviously, literally scratched the surface, but I think getting a survey of the field and be able to look at that would be wonderful. So, all right, everybody, stay safe and stay well. Have a lovely weekend, and see you next week.